Today you will be shown how to safely transition a patient who has undergone a right total knee arthroplasty or total knee replacement from a wheelchair to a front-wheeled walker, and then how to instruct them to safely ambulate using partial weight-bearing precautions.
You should consult your physician or other healthcare professional before performing these skills or tasks to determine if you are able to perform this level of activity safely. This is particularly true if you or a family member have a history of high blood pressure or heart disease, or if you have ever experienced chest pain when exercising, or have experienced chest pain in the past month when not engaging in physical activity, smoke, have high cholesterol, are obese, or have joint problems that could be made worse by a change in physical activity. If you experience faintness, dizziness, pain, or shortness of breath at any time while performing these skills or tasks, you should stop immediately. Stop immediately if anything causes you pain.
The first thing you need to do when working with a patient is to double check and make sure that the brakes for the wheelchair are on. They are located on the sides above the wheels, and to lock them, you press down until you feel a click. Before placing a gait belt on your patient, please make sure to ask about all of these contraindications that are listed here. Here you can see a PT placing a gait belt on a patient. To put the gait belt on, have the patient lift their arms so that you are able to slide the belt behind their back. Tighten the belt around their waist, pulling it through the teeth side first, then securing it. Make sure the belt is tight but comfortable around their waist. Because this patient just had a knee replacement, also known as a total knee arthroplasty or TKA, they have weight-bearing orders for partial weight-bearing, which means that they can place around 25 to 50% of their body weight on their impaired leg while walking. Make sure to explain this to your patient in case they forgot what their status is. To test how much weight the patient is using, you can place their foot on a scale if it's available and have them shift their weight onto it. If you do not have a scale, you can place your foot under theirs as a visual and tactile reminder that they shouldn't be placing all of their body weight on their foot. This can be a good way for the patient to understand how much weight they are allowed to put through their leg. This is a rolling walker. To measure the height, stand within the walker and drop your arms to the side. This walker is much too high because it doesn't fit at the wrist crease. To adjust the walker, flip it over so that the legs are up and change the height by pressing the buttons and sliding the legs down. Make sure that all 4 legs match up. Flip it back over and recheck the wrist crease to make sure that it fits. When preparing to have the patient stand up, explain that they should push through their arms on the wheelchair and put most of their weight through their uninvolved leg. To stand up, have the patient scoot forward in the chair. Their feet should be shoulder width apart and the uninvolved foot should be slightly behind their knees. Make sure to keep the involved leg stretched out a little bit more. Explain to the patient to move their nose over their toes as they are getting up to help give them momentum and shift their weight forward. Once standing, they can place their hands on the handles of the walker. Make sure to remind your patient of their partial weight-bearing precautions before having them walk. To guard the patient properly, stand on their impaired side and hold the gait belt while they stand up. Make sure to stand slightly behind the patient at around a 45-degree angle. When instructing your patient on how to walk with a walker, have the patient push the walker forward first, then step with their involved leg. After the involved leg is through, have them step forward with the uninvolved leg to meet it. This is called a step 2 gait pattern. Be sure that when you're walking with these patients, you are walking at a pace that is both comfortable for you and for the patient. When instructing a patient on how to turn, it is best to perform a larger turn towards their uninvolved side because it is easier on the patient and enables them not to break their partial weight-bearing precautions. Make sure to stay with the patient throughout the turn to ensure proper guarding for safety. As you are approaching the wheelchair, have the patient turn around to get them in the proper position. Make sure to continue to guard them on the involved side as they are turning. Once they are turned around, have them back up until they feel the seat on the back of their knees. Instruct them to reach back for the armrest and slowly lower down into the seat. Make sure to keep your hand on the gait belt to avoid the patient from plopping into the chair. Here is the process as a whole, so you can see it all the way through. Now that you've seen us perform these tasks, give it a try. Here are a few more videos of this process from different angles so that you can see how it looks. Great job! Keep practicing! Thanks for watching!